This segment is considered a final assessment of the progress the students made over the pilot. The video features students' reflections on what is required beyond healthcare to create good health. In January 2022, students were invited to upload a 2-minute video answering one of two questions. 1. Tell a story about fixing people and places. Why is it important that we do both? 2. Why would addressing cultural competency and/or medical racism be insufficient to remedy health inequities? Finally, an associate professor, Beverly Deladow, in the Marshall School of Medicine and co-director of the DDRS pilot reflects on the significance of the project.
I chose to answer the second question. To address cultural competency that will bring awareness where there might have not been before, and to address medical racism would improve behaviors of medical personnel in the way that they act and think consciously and implicitly with their patients. However, it's not addressing the root of the problem. It's kind of like the symptoms that manifest from it. They're the downstream effects that have stemmed from systemic policies and infrastructure that have built a very sturdy foundation for racism, classism, things like that. So policies change, that's like a point that's been harped on a lot, is that where you really get that real change and then you can see positive downstream effects. So it kind of trickles down. And then the issue is that policy and politics go hand in hand, and that presents a lot of challenges. But hearing from community leaders and organizers has been very encouraging, and it makes me realize that it's not impossible. It's something that we definitely need to try to achieve.
The question is, why would addressing cultural competency and/or medical racism be insufficient to remedy health inequities? For starters, cultural competency and medical racism are very, very important things to address, to consider and to improve upon at a societal level. On a basic level, bringing these issues to light can help improve quality of care in some aspects. It can make physicians and providers more aware of bias and medically adjacent factors that impact health, such as environmental or even historical issues. However, the true nature of these health inequities lies deeper than simply just the visit to the doctor. There are many intrinsic, extrinsic factors based on location, historical inequities and the like, that make it difficult to access healthcare in the first place. To truly address the root of these inequities, programs, legislature and infrastructure are vital to bridge the gap towards equity. These are systemic issues, and systemic changes are warranted at the local, regional and societal levels in order to achieve true change and not only patch what is evident on only the surface.
I'm going to be answering question number 2. Why would addressing cultural competency and/or medical racism be insufficient to remedy health inequities? I think what we've been talking about throughout this course is that addressing these issues from the point of patient contact with a provider isn't enough to mitigate these issues or resolve these issues. It has to be done from a level much higher up than that point, where you actually see the disparities manifest themselves into physical ailments or disease. Something that I really enjoyed from Friday's lecture was talking about how infrastructure isn't conducive for everyone. We were talking about how in Houston, the roads are not built for people or designed for people who have to walk, which I think that you can see that many different places that just don't have a lot of infrastructure or public transportation. And this got me thinking about how if you don't have a sound public transportation system, as a lot of rural communities do, and because they're rural, there's limited access to groceries, and doctor's appointments, things like that. And if you don't have a car as well, you're dependent on other people to get places to transport you places, because there's no public transportation system to fill in these gaps. This is just one small example of how having a provider have a recognition of these kinds of issues wouldn't be enough to mitigate them. In a sense, that has to be done from a much higher level.
I'm a first-year medical student at Marshall University, and I'm providing my response to the prompt, why would addressing cultural competency and/or medical racism be insufficient to remedy health inequities? This is an interesting question that does not have a simple answer. What I've gathered so far is that certain individuals that may not be at the forefront of health policy have more power to take greater steps and apply much of what has been discussed as far as structural change. I've come to value the importance of these discussions as a future physician and a community leader that will one day be in a position to be a stronger advocate for mediating these inequities. Another idea as to the lack of progress in alleviating health inequities is the result of the generational disparities resulting in oppression, particularly in underrepresented minority groups. For example, the presence of food deserts in low-income communities, which have been around for years, is fueling the flame of chronic illnesses such as hypertension, diabetes, cardiovascular disease. The list goes on.
The way I view it, this is important because it takes the emphasis on and broadens it. So we're used to and trained to think of diversity, equity, and inclusion as applying to individuals. You treat this person fairly, you treat those people, that it's about individual interactions. And I think this broadens the awareness of how different people interact to something that is more aware that how societies act, how the systems that exist long term can set up unequal access to resources, to health, to funding, all kinds of things. And I don't know that students obtain that awareness in their earlier education unless they've focused within the social sciences, and a lot of our students do not. So it is something that students are not particularly aware of, to look at how is this system set up so that inequalities are simply produced by the way it exists. That's not something, it's not something the faculty in many of us had seen before. Something I was aware of, but not to the depth that I am now. This has been a learning process for me too.